What is tPA and how does it help stroke symptoms? Imagine a tiny blood clot blocking blood flow to part of the brain, causing sudden weakness, speech trouble, or even loss of balance. When this happens, quick action can make a big difference. One of the key treatments used in these emergencies is a medication called tissue plasminogen activator, or tPA. tPA is a special protein that helps dissolve blood clots. It works by turning a substance in the blood called plasminogen into plasmin, an enzyme that breaks down fibrin, which is the main component of blood clots. When someone has an ischemic stroke, where a clot blocks blood flow to the brain, tPA can be given to dissolve the clot. This helps restore blood flow to the affected brain areas, which can reduce the amount of brain damage and improve recovery chances. The way tPA works is quite precise. It binds to the fibrin on the surface of the clot and activates plasminogen right there. This activation turns plasminogen into plasmin, which then cuts through the fibrin mesh holding the clot together. As the clot dissolves, blood can flow freely again, which often leads to a quick improvement in stroke symptoms like weakness or speech problems. Timing is very important with tPA. It is most effective when given as soon as possible after symptoms start, ideally within 3 to 4.5 hours. The sooner it is administered, the better the chances of reversing damage. Doctors carefully evaluate each patient to make sure they are suitable candidates for tPA because it is not safe for everyone. They need to rule out other types of stroke, especially hemorrhagic stroke, which involves bleeding in the brain, as giving tPA in those cases could cause serious bleeding. While tPA is quite effective at breaking down clots, it can also cause side effects. Because it can activate plasmin throughout the body, it may increase the risk of bleeding elsewhere, including in the brain. That's why medical teams closely monitor patients during treatment and follow strict guidelines to ensure safety. In summary, tPA is a powerful tool in stroke care that can help dissolve blood clots blocking blood flow to the brain. When used promptly and carefully, it can significantly improve outcomes for many stroke patients. If you or someone you know shows signs of a stroke, such as sudden weakness, speech difficulty, or loss of balance, immediate medical attention is essential. Always remember, quick response and proper treatment can save brain tissue and lives. For personalized advice and treatment options, consult healthcare professionals without delay.